Hello, I'm Dr. Kevin Brummond. I'm a member of the American Academy of Otolaryngology Head and Neck Surgery. If you've been told that you have a thyroid nodule or suspected that you have a thyroid nodule, you will be subsequently sent for an appropriate workup. Your physician may order some blood work to assess the functioning of your thyroid gland, and ultimately you would have a formal thyroid ultrasound done. An ultrasound is a radiographic study typically done in a radiology suite or by a surgeon or a physician. It's non-invasive, well-tolerated, and there's no radiation exposure. The ultrasound of your thyroid gland will give a great assessment of your entire thyroid gland and the nodule. Based on the size of the nodule, as well as the sonographic characteristics associated with it, additional workup may be recommended. Sometimes no additional workup is recommended, given that thyroid nodules are quite common and the great majority of them are benign. If an additional workup is recommended, it will likely be a fine needle aspiration biopsy of the nodule, also called an FNA. An FNA is typically done in a physician's office under local anesthesia. After appropriate positioning, a physician will inject some local numbing medication, such as lidocaine, into your neck skin, and under ultrasound guidance, take a sample of the cells that make up the nodule and put those on a slide for appropriate analysis by a pathologist. The pathologist will interpret the cells on the slide and determine what the next step is in management, if anything. Again, if the nodule turns out to be benign, no further workup is necessary. Occasionally, a thyroid nodule after fine needle aspiration biopsy will be shown to represent a thyroid cancer. If that is the case, additional workup may be necessary or surgical intervention would be discussed with you. The extent of the surgery would depend on a number of factors, including the size of the nodule and any other associated concerning findings. Other fine needle aspiration biopsy results give a more clouded picture and no distinct diagnosis separating it from benign versus malignant. In those situations, there are a couple of options. In some instances, repeat needle biopsy may be necessary, or a sample of your needle biopsy may be sent to a third party for what's called molecular testing to help clarify whether or not the nodule is benign or malignant. Occasionally, to answer the question whether it's benign or malignant, a surgery is required to remove that part of the thyroid gland that includes the nodule. If you have any further questions or concerns regarding the initial workup of a thyroid nodule, or you are looking for a physician to help you navigate that pathway, please visit our website. Thank you.